my name is Lee Washington, patient of Dr. Heyman's, and he asked me to give some information in regards to noise exposure. And the kind of noise exposure he's talking about is aspirating fluid from the mouth when he's doing dental work, and what kind of effect does the noise level have on the hearing. Well, noise level is the #2 reason why we have hearing loss, behind presbycusis, which is the aging process. The level of noise exposure at 80 decibels requires in a factory that you wear ear protection. At 90 decibels, you have to have ear protection, or you can't enter the factory. Otherwise, the OSHA or the company could be even shut down by OSHA. So we can see that noise exposure is really a factor that needs to be addressed, especially with dentists who are dealing with a decibel level of 85 plus in their work environment. At 90 decibels, they're actually impairing their hearing, especially in the high frequencies.
Okay, Lee, now let's show them. I'll show you the decibel level of the normal HVE tip, and you can look at the decibel level. You can read it off and tell us what you're seeing, and then I'll show you the modified version, and I want you to tell me what your impression is of that, okay?
Sure.
So I'll turn on the decibel level meter. First I'm going to turn on the standard HVE tip, okay? And what are you reading at a foot?
I'm reading that 94 decibels right now.
Okay, and that would not be so good for the hearing?
It would actually be a hearing impairment.
Okay.
At any length of time, periodically, day by day, in this environment, you would lose your high frequencies, starting at 2,000 hertz.
Okay, so let's take a look now. We'll shut the regular one off, and I will turn on the modified one. Now I want you to tell me, what are you reading there for the decibel level?
It looks like about 80, 79 to 81.
Okay, so at the decibel level that you see the modified HVE tip, would you categorize this as the safe level?
Yes.
Okay. Do you see any need for having to wear hearing protection with this?
If you had the modified one, I'd say no.
Okay, but with the unmodified one?
Absolutely.
So you would not recommend dentists to use the HV tip without some form of hearing protection?
If they're in that environment for any length of time, they're going to have serious high-frequency hearing loss. The cochlea will not be able to take a level of that noise level for any length of time without the hair cells bending and breaking off. Consequently, it would cause high-frequency hearing loss, which would affect their ability to communicate with women, children, group situations, and things like that.
So do you think that it's a worthwhile endeavor to utilize the modified HVE tip as a universal standard in dentistry?
I would, absolutely. If they want to maintain their hearing and without hearing loss, they have to protect it. And without that protection, they're opening themselves up to a variety of hearing losses after 85 to 90 decibels.
Very good. Thank you, Lee. I appreciate it.
You're welcome.